after there was a feast of the Jews, and Jesus went up to Jerusalem. Now there is at Jerusalem by the sheep market a pool, which is called in the Hebrew tongue Bethesda, having 5 porches. In these lay a great multitude of impotent folk, the blind, halt, withered, waiting for the moving of the water. For an angel went down at a certain season into the pool, and troubled the water. Whosoever then first after the troubling of the water stepped in was made whole of whatsoever disease he had. And a certain man was there, which had an infirmity 38 years. When Jesus saw him lie, and knew that he had been a long time in that case, he said unto him, Wilt thou be made whole? So reads the beginning of the 5th chapter in the Johannine Gospel of the New Testament, a distinct narrative from the 3rd miracle recorded in the Synoptic Gospels of Matthew, Mark, and Luke, where Jesus for the first time appears to heal a person without any gestures, but only mere words. But also in that story, rather than finding a man lying by a well, with a history of troubled waters and an angel's touch not reported in the Vulgate text and only in the Latin manuscripts, we find even the Lord noting the remarkable faith of the friends of the lame man who had carried him to the Lord because of their faith in his heavenly power. And this is an interesting biblical story during a pandemic time in which just recently the nation's only physician, healing himself, serving as a state governor, has announced that both he and his wife have been afflicted with what he has referred to as a highly infectious pathogen, about which for months he had encouraged Virginians that a facial covering would protect them. But apparently, despite his continued faith and exhortations to Virginians to wear masks, failed him. So for a moment, let's take a while to discuss the faith in science that drowned a physician, Governor Ralph Northam, in detrimental reliance. The impotent man answered him, Sir, I have no man, when the water is troubled, to put me into the water. But while I am coming, another steppeth down before me. Jesus saith unto him, Rise, take up thy bed, and walk. And immediately the man was made whole, and took up his bed, and walked. And on the same day was the Sabbath. According to one account that appeared in the Washington Post, the two were tested Thursday after learning the night before that a member of the governor's official residence staff, who works closely with the couple's living quarters, had developed symptoms and subsequently tested positive for COVID-19, according to a news release from Northam's office. Both the governor and First Lady received PCR nasal swabs tests yesterday afternoon, and both tested positive. According to another account that appeared in the Daily News, the new Democratic politician, who's 61, does not have any symptoms while his wife is experiencing mild symptoms. The couple is expected to isolate for the next 10 days. And according to yet another account that was broadcasted on CNN, both will isolate over the next 10 days, and the governor will continue working from home. Yet another account that appeared in the Washington Times wrote some Republican lawmakers criticized his restrictions aimed at slowing the spread of the coronavirus, calling them too stringent. And according to yet another account, the governor himself stated, as I've been reminding Virginians throughout this crisis, COVID-19 is a very real and very contagious. Most importantly, he urged his fellow Virginians to take this seriously. Yet, while one would certainly want to believe what was printed in the press, and also would want to believe the medical opinions of the nation's only physician serving as a state governor, there are distinct problems that arise in just these simple accounts, especially Dr. Northam's public statement that the contagion is very contagious. The governor's mansion measures more than 614,000 square feet, practically a city block. But this reportedly very contagious pathogen managed apparently to only infect a total of 3 people, including the index case, which appears to be a member of his staff. It was findings like this that caused the World Health Organization in February, after examining over 59,000 laboratory-confirmed cases of COVID-19 in China, to restrain from concluding that a novel coronavirus was either being transmitted from person to person or even a communicable disease at all, a necessary finding for Northam to determine, for him to even begin to implement regulations that have made facial coverings compulsory, closed businesses, and relegated weekly devotional worship to mere televangelism. In fact, according to one document published by the Alexandria Department of Health on March 15th, after Northam had prohibited all gatherings of 100 persons or more, effectively suspending worship services indefinitely in any large church, the guidance stated, the general public is currently at a low risk because we are not yet seeing transmission where the source is unknown. Yet according to VA Code 32.1-48.06, the governor was required to have definitively identified before that act an affected area known to have been exposed to or infected with, or who are reasonably suspected to have been exposed to or infected with a communicable disease of public health threat, exceeding or abusing his statutory authority. Generally, infectiousness is established by a systematic identification of an infected person who can reasonably be expected to report to a medical facility and be tested during a pandemic if he wants to get well, and by conducting interviews to identify persons with whom the patient had been in recent contact or tracer contacts. For a contagious pathogen like measles or chickenpox, both intriguingly described by clinicians as a respiratory tract infection because of the means by which persons are actually infected, the attack rate is as high as 90% or higher, and 9 out of 10 persons with whom an infected person comes in contact will also become infected, which is why these are considered to be the most contagious diseases in the world known to man. Similarly, smallpox, for which vaccinations were made compulsory in the early 1900s, not long after the first discovery of viruses in plants and animals, but not yet man. The attack rate is as high as 60%, while the common flu infection may range between 20 and 40% in an attack rate. But even after examining tracer contacts from over 59,000 persons in China, teams of 5 epidemiologists performing thousands of tracer contact follow-ups per day could not find a 5% attack rate, especially the further away they moved from Wuhan. And in a case that the New York Times claimed to have baffled the scientists in April, the very first American confirmed to be infected with a novel coronavirus, our patient 0 took a 20-hour flight from Wuhan, shared a 25-mile share ride home, and roamed around the Puget Sound for 4 days, coming into contact with at least 68 persons, and failed to infect anyone. But apparently, since the governor was one of only 3 persons infected in a mansion, he now claims that a novel coronavirus is highly infectious, without ever determining the attack rate for the pathogen. It is certainly suspicious in itself, but also coincident with an announcement of a filing in the Fourth Circuit Court in Richmond, the federal appellate court, in which his failure to determine that a communicable disease existed was being challenged. That the 61-year-old governor has now told the world that he is infected, but also asymptomatic, or not presenting any symptoms, like mild fever, of any illness at all. Legally, this is a significant problem for the governor because under U.S. v. Climico, false exculpatory statements can be used to establish circumstantial evidence of criminal behavior. The Jews therefore said unto him that was cured, It is the Sabbath day. It is not lawful for thee to carry thy bed. He answered them, He that made me whole, the same said unto me, Take up thy bed and walk. Then asked they him, What man is that which said unto thee, Take up thy bed and walk? And he that was healed wist not who it was, for Jesus had conveyed himself away, a multitude being in that place. According to the Washington Post, the virus, which is easily spread from person to person, has a relatively long incubation period, and an unusually large proportion of people infected with it have no symptoms, according to the Centers for Disease Control and Prevention. Yet while a layman may not know, but certainly a physician is aware, there is a clear distinction between that which is called a symptom, which must be tested, like using a thermometer to determine a fever, or what a clinician refers to as a sign, like coughing or sneezing. Also indications or asymptomatic presentations of an illness that is immediately apparent from naked observation. According to CNN, both will isolate over the next 10 days, and the governor will continue working from home. And apparently this is the newest guidance on quarantine protocols from the Virginia Department of Health, according to Delegate Danica Rome, who was with Northern's wife, as reported on NBC News. While each report of the incident attempts to emphasize that the governor is tracing his contacts, an initiative that he reportedly has failed to initiate as soon as the pandemic pathogen arrived, hiring in June only 168 new personnel from over 6,000 resumes received in April for 1,300 positions. The 10-day quarantine becomes even more problematic because, as the Washington Post reported, the coronavirus 19 disease, or COVID-19, has a relatively long incubation period, and an unusually large proportion of people infected with it have no symptoms at all. And accordingly, the standard protocol for any contagious pathogen, even before this pandemic one, has been not only 14 days to ensure that a patient is clear of infection, but also for that 14-day count to begin only after viral remission, or in layman's terms, when a person is cured, free from infection. Northern is 61, and so is in a higher risk category, a fact which we have known about since the very beginning. But Northern also permitted half of the fatalities to accrue amongst elderly in nursing homes who were at high risk, and also died and were found to have died in China. And unless he intends to pray his pathogen away, physician healing himself, in 10 days his virus should, to a mathematical certainty, still be there, or only beginning remission, for which the CDC has determined in mild cases to run for a total of 21.1 days. That is the remission period for this pandemic pathogen in mild cases. Afterward, Jesus findeth him in the temple and said unto him, Behold, thou art made whole. Sin no more, lest a worse thing come unto thee. The man departed and told the Jews that it was Jesus which made him whole. And therefore did the Jews persecute Jesus and sought to slay him, because he had done these things on the Sabbath day. My name is Major Migrant, and I am running for U.S. Congress with liberty, honor, and excellence. By God, we shall make America great again. Honest. This advertisement was authorized by Mike Webb.